Yeah, hi Wendy. So I'm a vet in rural mixed practice up here in Guyra. So that means our clinic sees lots of different types of animals, from livestock, horses, cats, dogs, rats, mice, the odd snake, everything. So I guess we are exposed to a lot of zoonotic diseases which we can catch from animals that we need to be mindful about.
Terrific. And so focusing in on Q fever, what is it and what animals are affected?
Okay, so Q fever is an infectious disease that we can catch from animals. That's the definition of a zoonotic disease, essentially. It's caused by a bacteria. The bacteria is Coxiella burnetii, and a lot of the times animals don't show any clinical signs, so you might not know that they're infected with this bacteria when you're seeing them. And really, it can affect most animals that we deal with on a daily basis. Livestock most commonly, but also your domestic pets, your cats and dogs, and wildlife as well. So kangaroos and all of our baby mammals can also be affected.
Now, just before we started, you mentioned that goats are one of the few animals that might show clinical signs. What would they look like?
So a lot of times, as I said, animals don't show any clinical signs, and the first time a farmer might know that their animals are carrying the Q fever bacteria is when their family members start to get sick or they go to their doctor with signs of Q fever, and then that's the only time that they will know that it's in their herd. But goats seem to be a bit more susceptible to suffering clinical signs, and usually it might present in the form of like reproductive losses, abortions, that kind of thing.
Right, okay. And how's it spread to people?
So it's spread to people through aerosol mainly. Any cuts on your hands, if it becomes aerosolized and lands in your eyes or in your mouth, direct contact. And then there's certain at-risk activities as well. So it's really prevalent in high amounts in birthing fluids, placentas, amniotic fluid, all of that kind of thing. So if you're assisting with a calving, that would be considered a high-risk activity. And it's even been a vet clinic in Sydney contracted it with a puppy cesarean, and quite a few staff members there got really sick through helping the dog give birth that way. So yeah, they're the main ways.
And so what would you do to protect yourself?
So we're really lucky here in Australia. There's actually a vaccine that was developed in Australia. So it's really quite effective. All vet students get vaccinated, which is great. And anyone really working on the land, in abattoirs, even wildlife carers, really should look at getting themselves vaccinated. That's the most effective way to protect yourself. But certainly PPE as well. So we'll put gloves on when we're assisting with any births, wear a mask if necessary, good hygiene, hand washing, all of that kind of thing.
Okay, and you said there aren't many clinical signs in animals. Do producers do anything to manage it in livestock?
Not really, not that I'm aware of. It's not really a disease that they actively manage because, as I said, a lot of the time their animals are not sick and they might not even know that they have it. But if it is diagnosed in animals, it can be quite easily treated with antibiotics.
Okay, and what people are most at risk of getting Q fever?
So most at-risk people would include people who work with animals and livestock, basically. So vets, farm hands, the children working on the properties, wildlife carers, as I mentioned before,
yep.
And abattoir workers, high risk,
yep.
and shearers and things, so sheep, and it can stay in the wool. Yeah, most people working in rural New South Wales and Queensland, really.
Yeah, okay. And what other things might be of interest to medicine students about Q fever? that will help them understand perhaps cases that present to them in the ER or in clinics, that sort of thing?
I guess it's just something that they really need to be aware of. If someone presents with flu-like symptoms, for example, or fever, just asking the question, have they been around livestock or assisted in a cow giving birth recently? The incubation period can be really quite long as well, up to 2 months. So it's not something that you're going to help with a calving and be sick the next day. I think the minimum incubation period is about 2 weeks. So it's about thinking back to see if they had any exposure in that, 2 weeks to 2 months ago, and just checking vaccination history, I guess. The vaccine can only be given once, and there's a bit of a process too, because you have to make sure that you haven't already been previously exposed before you get vaccinated. So they usually do serology or a skin test before you get your vaccination. And in Guyra, actually, where we work, we have one of the highest incidences of Q fever in New South Wales and possibly Australia. So I think a recent study showed that 1 in 5 people tested in Guyra had already seroconverted, so already been exposed to Q fever, which I found interesting. Yeah.
And you mentioned with some of the research that's been done that there are signs that males may be more susceptible to Q fever than females.
Yeah, that's right. That's something I came across when I was doing some reading. And I think at first the theory was, well, more males are working on the land, so they're more likely to get exposed. But actually they think that estrogen has a protective effect in terms of women don't seem to get as sick or become infected as easily. And even all the studies they do in animals, they usually use male animals, I understand, because they're more likely to have a more significant fever response and more significant clinical signs. So this is the graph of the age group, and like the black bar are the males and these stripy bars are the females. So it's like really significant. I think middle-aged people are most susceptible and are the ones getting infected the most. And I think that's probably because once kids finish school or finish uni, that's when they go out and that's when they're potentially getting exposed. So that kind of 30 to 50 years old age group.
Thanks very much.
No worries. Thanks, Wendy. See ya.